Thank you, Madam Deputy Speaker. It is an honour to speak in the debate today to raise the plight of my constituents in Bognor Regis and Littlehampton, some of those who are struggling in silence, pain and frustration, simply trying to access basic NHS dental care. But I'd also like to thank the Honourable Member for Great Grimsby and Cleethorpes for bringing this debate, and to say that I share her views on pretty much everything that she has said, but particularly on the wider impact of poor dentistry on A&E, the NHS more widely, and particularly on cardiac health. So, Madam Deputy Speaker, I have many constituents' testimony to refer to today. So let me begin with the real story of a real person who has worked tirelessly her entire life and now, due to long COVID, is housebound and dependent. When she missed one single NHS dental appointment due to illness, she was removed from the list. Since then, she's not been able to find another NHS dentist. When an infection struck, she waited a week for emergency care at St Richard's Hospital, and she is not alone. In 2023, only 24.7% of adults in the South East were seen by an NHS dentist in the previous 2 years, the second lowest rate in England. In some areas, fewer than 1 in 5 adults have been able to access NHS dentistry. Yes, the government have announced recent steps. 26,546 additional urgent care dental appointments for Sussex, a rise of 245 to 455 per week. A £20,000 Golden Hello relocation incentive to attract dentists to underserved areas. And 17 of these posts have been approved for Sussex. And whilst I welcome these steps, they are not enough. The DDU and the Public Accounts Committee have made it clear, as other colleagues have said, that NHS contract is broken, disincentivising dentists from treating those patients with the greatest needs. In 2022, 91% of dentists surveyed felt worn out, 84% reported burnout. They're walking away from NHS dentistry, not out of disinterest, but because the system is unsustainable. So I ask the Minister, how many of the urgent contracts are now available, and when will real contract reform take place?